morning friends, and welcome back to another session of Has lecture series. Now from today I will be discussing about enzyme induction and inhibition. A few animations that I have tried to incorporate, which I have developed. Maybe learning becomes much more easier looking at those animations. Now both these processes of induction and inhibition are of great help in clinical pharmacology, especially prescribing of two or more drugs. Okay, so one drug can be an inducer or an inhibitor, and it can definitely affect the metabolism of the other drug, or it can also affect the metabolism of its own. So that's where the frequency of administration of a drug, the dose of a drug might have to be altered, and the effects may or may not be seen depending upon whether it's an inducer or whether it's an inhibitor. Definitely in an inhibitor it would be more of a toxic effects that would be seen. So that was just on what this induction and inhibition, but let's start discussing it in more detail. Now enzyme induction, I always split the terms to make it simpler for us to understand. So enzymes, so what are these enzymes in the body? Enzymes, especially dealing with pharmacology, would be the cytochrome P450 enzymes, or also called as microsomal enzymes. And on the other hand, what we also have as a non-microsomal enzymes. Okay, so these enzymes are helping in metabolism of the drugs, because drugs are after all foreign substances, so they are metabolized in the body. Now if you are new to my channel, go back and click on my video on drug metabolism to understand more about drug metabolism. So enzyme induction, so these enzymes are inducted, their synthesis is accelerated, their activity is accelerated over a period of time, and it helps in faster metabolism of a certain drug. So that is what you mean by enzyme induction. So for enzyme induction to occur, you should be giving the drug on a repeated doses chronically, or need to give the drugs on a very higher scale, very high doses for the process to start. And remember, when you talk of induction, it is something of a microsomal enzyme process. We are not dealing so much with the non-microsomal enzymes when we talk of enzyme induction. Now induction of enzymes doesn't mean that you are accelerating the working capacity of the existing enzymes. No, we are trying to synthesize, the body is trying to synthesize more amounts of enzymes. De novo synthesis of enzymes takes place, and that is the reason that you get this enzyme induction process. Now enzyme induction, now it is not going to occur suddenly in the body. No, it's not like that. For that I give a very good example. It's like starting a car. For example, you are driving for possibly any car which is around now 50 years old and has not been kept in a proper way. So 50-year-old car which is not been well maintained will take some time to start, right? Okay, you put on the key, definitely key, that time there was no auto start, not finger start also, identification, nothing was there at that time. So we just started the cars with the key, right? So you just put on the key, turn the key, and it used to be a sound for some time, and then the start would and then the car would start, right? So induction takes place sometime. So it's the start of an engine takes place sometime. So does enzyme induction. So don't expect induction to occur in just one day or 2 days. It requires at least a week or more for the induction process to start. Everything in nature is the same, whether artificial or natural. So believe me, starting an engine would take some time. So does induction process for the enzymes and the effects to occur. So if you get an effect only on the next day after starting a drug, don't say it's due to enzyme induction. Cannot happen like that, right? So in general terms, so think about that, and need to know also and remember some points on enzyme induction. Now that's very important from induction process. These drugs are substrates for enzymes. They include definitely it's going to be, a particular drug is trying to get metabolized by a particular cytochrome P450, right? We have types of P450. For example, a drug is getting metabolized by cytochrome P450 or CYP3A4, then particularly it will only affect that particular enzyme and so on. And because that, or in the other sense, if this enzyme was inducted, then only this drug will get induced. So it's going to be that the drug needs to go through that pathway of metabolism. If it is going through some other pathway, its metabolism may not be affected. Now, as I discussed, there can be selective or non-selective inducers, right? So some inducers might be like generalized inducers, they induce almost all enzymes in the body, or it can be just a selective inducer. And you need to be aware, as I said, when you are administrating co-drugs with this inducer, right? Because it's going to induce the metabolism. This cytochrome 450 is going to induce metabolism of this particular drug, but if the other drug is also following the same pathway, its metabolism is also going to get induced, so the effects of the other drug might go down. So need to be careful when you administer drugs with common pathways, especially giving it with inducers, and the effects of the other drugs may also go down. Now that was about enzyme induction. Now some drugs have the capacity of auto induction. Okay, so they induce metabolism of enzymes on their own, and at the end of the day they also induce their own metabolism. Okay, so something that also needs to be thought of. The best example of auto induction is definitely carbamazepine, induces its own metabolism, and the levels may go down on a faster way, especially the blood levels. So you need to be aware of the dose, the frequency of administration, and so on, if the drug has to be effective. Now, examples of drug causing microsomal induction would be phenobarbital, again a sedative drug, a barbiturate drug. We have carbamazepine, that's again an anti-epileptic drug. Rifampicin, which is again an anti-tuberculous drug, but has a lot of microsomal enzyme induction capacity. And now there are few animations. I just said to you in words what does enzyme induction mean, but let's see by animation way what this enzyme induction is. And now this animations might take some time to start up, so bear with me. So I start the animation. So here is a normal drug, call it as a drug XYZ. Now you can see this person walking across, and this is his normal pathway, his normal speed. Okay, this is his normal speed of walking. You can just, okay, so he's walking in a very relaxed way. He's getting all the pleasures of walking, I should say. So that is what happens with normal drugs in the body, right? They have a normal course of action. They go inside, few of them might get not few, almost all drugs get metabolized over a period of time, and they get excreted out. So these are the ADME processes that we call of. So this is what happens with a normal drug. So just a first enzyme, what you can call as a normal pattern of how drug will behave in the body. Now here it is something called as enzyme induction, right? So here is a travelator. Okay, a person is walking across a travelator, and let's see what happens. Okay, so I just start the animation, and you can see this person is trying to move across the travelator in a faster way. Now let's watch it again. Okay, he comes in, he presses the button, travelator starts, and he walks across in a faster way. He's a smart guy, right? He is not a dull guy. He is smart enough to know that if he travels across the travelator, he can travel it very fast, and he's putting on the button, this red button here. So that's what is something which we call it as induction, right? So you're inducing the traveling time, okay, here by crossing it across the travelator. So this is the guy who is actually a inducer. So he's inducing enzymes and in the body. So this drug is inducing the enzyme. What we should call this person as ABC. So this person is ABC. It's not to do something with ABC kacang. We have something called a sweet dish in Malaysia, which is named after ABC. Not to talk of that here. Okay, so nothing to do with the food items. Okay, so this is a very smart guy traveling across in a greater speed. He's inducing his own enzymes by pressing this button. So he's traveling. So this is what happens to drugs in the body who are inducers. So they will induce the metabolism, and they will get metabolized in a faster way. So that is fine. Okay, that is fine. Now the third thing. Okay, if you have two drugs which are given in combinations with each other, now see what happens. Okay, The smart guy is coming along with uh, our previous drug XYZ. So ABC is with XYZ. So put it again, right? Where is the mouse going? Okay, so this is our ABC comes with XYZ. Now see what happens. Okay, the drug which is the inducer, the smart drug, is also taking along with it the normal drug, that is the ABXYZ. So its metabolism is also getting enhanced, its traveling time is also getting enhanced. He is traveling in a faster way, he is now traveling in a very smart way. So that happens with drugs in the body, especially with inducers. Now think that this is a inducer. So he is taking along with it the normal drug. So its metabolism is also going to get enhanced. Now the thing that you need to know in this is that this both drugs should have a common pathway of metabolism, right? It cannot be that he is traveling on this travelator and there is some other travelator here. No, it cannot happen that way. If the other drug has the same pathway of metabolism, its metabolism is also going to get enhanced, its levels are going to go down. So you need to increase the dose of a drug here, so that even if with the faster metabolism, its effect can remain. So these are some animations which can help you understand what is an inducer and what happens when you give drugs along with the inducer, right? So there are a lot of clinical implications associated when you give drugs with inducers, especially a few examples here. In fact, there will be an endless list of examples, but a few of that I just need to mention. Failure of oral contraceptives if given with enzyme inducers. So you have a fertile aged lady comes to you and she is already taking oral contraceptives, and then you start her on enzyme inducer, okay, any enzyme inducer for that matter, for any other disease, okay, phenobarbital or rifampicin. The effects of oral contraceptives are going to go down because they share the same common pathways. So the levels of oral contraceptives might just go down and it might become ineffective, and a lady can become pregnant if the chances are there. So a lot of clinical implications about why you should be asking about what other drugs you take along with these drugs. So that becomes an important prescribing issue. Loss of anticoagulant activity, okay, so if you are giving any inducer with other anticoagulants like warfarin and so on over a period of time, you can see that anticoagulant activity of these anticoagulants might be just lost, and it's harmful and may precipitate any cardiovascular event. Especially with seizures, okay, anti-epileptic drugs. We thought of carbamazepine auto-inducer, induces its own metabolism, so levels might go down. So if a doctor is not in a position to check what's happening with carbamazepine dose and what is happening with its level, then the person can end up into seizures just because after a few days the amount of dose of the drug which was given to that patient is not effective because of the faster metabolism. So the patient might require additional dose of a drug after a few days after starting this agent. So these becomes very core clinical pharmacology things that a person should know when he is prescribing any drugs. Now if that was all about induction, now let's start with inhibition. So let's again split the term enzyme inhibition. So enzymes, which are these enzymes? Again, microsomal, non-microsomal enzymes we thought of, and inhibition. So inhibition of enzymes. So you inhibit these enzymes from working, or the synthesis of these enzymes also may go down possibly, but inhibition is what we think of when we talk of enzyme inhibition. So enzyme deficiency do exist in the body. It's especially in infants, okay, premature infants or elderlies or persons with liver diseases, because these are the points at which there is a deficiency of enzymes. So if you talk of the extremes of ages, then body takes some time for all the enzymes to get developed. It's not on the very first day that you have a picture perfect body in this nature. Cannot happen. Over a period of time, body develops itself. So okay, premature infants will lack a few enzymes, so there would be difficulty in metabolism drugs in premature infants. Elderly's body deteriorates over a period of time, so elderly's extremes of ages might lack few enzymes. So of course pharmacokinetics, especially metabolism of drugs, might be altered in elderly. We will come to all these chapters, what happens to drugs in pregnancy, what happens to drugs in elderly, what happens to drugs in pediatric age group, but in our series to come, so not now possibly. So just know that in liver diseases also, some diseases, okay, it will try to bring down the levels of cytochrome 450 and cause a problem. So drugs also, in addition to these are natural causes, but drugs also do cause inhibition of enzymes. Now inhibition can occur at microsomal enzyme level, that is cytochrome 450 or other of those kind, and of non-microsomal. So it's both enzymes that would be inhibited. Enzyme inhibition has profound effect, okay, because we are talking of toxic effects of drugs coming in. The drugs are not going to get metabolized, and remember, all drugs to start with are poisons. The only thing is we use them at therapeutic doses, so that is the positive side from our side, that we use them in therapeutic doses, so it becomes so effective, but still we get side effect, right? So if you increase the levels of drug in the body, the toxic effects of these drugs are going to come. So enzyme inhibition has profound effects, in fact more than what you can get with enzyme induction. It's a more selective and a fast process. Now we'll come to this. It's a fast process, like again coming back to that old car phenomena. Now if I'm trying to stop an old car, right, if I have a very old car, the same old car we use for induction, right, we come back again to the same old car here and try to stop it. Think of you stopping a car, whether it be a press button or right, it might be a key. You just turn the switch off, the car will stop. It doesn't take a long time to stop, okay. You think of these scenarios. You start a car, it will take some time, maybe a few milliseconds. You might be talking of the best of best cars in this world, the sports cars, millions or billions of dollars car. It takes some time to start, but you want to stop a car, to stop an engine, it takes hardly any time. It is like a millisecond effect. You won't even realize when it stops, right? So see, inhibition is a mostly a faster and more selective process. A reduction of dose might be required. If definitely if the drugs are not going to get metabolized, their levels will go up in the body, so you need to reduce the dose of a drug in case there is some kind of enzyme inhibition occurring. And several drug to drug interaction again are important when you talk of enzyme inhibition, okay. So drugs do inhibit enzymes, and there will be drug interaction occurring with enzyme inhibition. Now here is again one more of enzyme inhibition animation. So you think of drug to drug interaction. Now think of this as what is. So this is a smart guy, but now he is turning up to be a very he doesn't want to travel, right? He doesn't want to travel. So what he does something different. He comes, he is not going to step onto the travelator. He is not going to step onto the travelator. Can you see that? This is a travel. He is not getting, but at the same time he's also trying to avoid the other drug or the other person from getting on to the travelator. So that is what is enzyme inhibition, right? So if the drugs share common pathways, so they are not going to get metabolized, and so that's what happens to drugs with inhibition capacity, enzyme inhibition. So first drug not up to the mark, so inhibiting the enzymes. The second drug, if given, if possibly if given along with the inhibitor, is also going to stop the metabolism of the other drug. See his hand going up, stopping the other drug. So that is what you talk of enzyme inhibition as far as animations are concerned. Now examples of drugs causing enzyme inhibition: cimetidine, what is that, antihistaminic drug, H2 blocker used for peptic ulcers, omeprazole, ciprofloxacin, erythromycin, antibiotics again which can cause enzyme inhibition. Aspirin also blocks enzymes called as platelet cyclooxygenase, so prevents of CVD. Enalapril causes inhibition of enzymes called as ACE, that is angiotensin converting enzyme, helpful in hypertension. Selegiline blocks enzymes called as MAO-B, monoxidase B, monoxidazamine B, helpful in depression states. Disulfiram will block the enzyme aldehyde dehydrogenase and is helpful for addiction of alcoholism. So these enzymes are also blocked in addition to the previous one on drugs like omeprazole. They will be talking more of microsomal enzymes, but these are the non-microsomal enzymes that would be inhibited by drugs. Uh, Now here are few drugs which have drug to drug interactions. So if you give metronidazole along with alcohol, it shares that disulfiram like reactions, blocking that aldehyde dehydrogenase. So levels of alcohol might go up and the patient might not be happy with that, causing a lot of problems. So when the patient is taking metronidazole, tell him to avoid alcohol. If the patient is on cimetidine ciprofloxacin, they increase the levels of theophylline. Now here it is more of microsomal enzymes, so they increase the levels of theophylline, and then the toxic effects of here theophylline might come up. Activation of CNS, super activation of CNS, super activation of CVS, and so on. So a lot of problems for the patient. Erythromycin can have drug interactions with methylprednisolone, especially enzyme inhibition. Allopurinol might also have interactions with some drugs like azathioprine. So these are enzyme inhibition, and there can, so these levels, the levels of these drugs can go up on this side if you are giving these drugs along with these drugs. So there's a lot of issues with enzyme inhibition that you need to know, but a few examples would be cimetidine, ciprofloxacin, erythromycin. These are gold standard examples. Oral contraceptives and phenytoin enzyme induction. So these are few things that you need to know at least when you are prescribing. The others would be many, but definitely not something that is humanly possible to remember everything. So that was my quick analysis on enzyme inhibition and activation or induction. I hope you like my series. Do click the like button if you feel so. Do subscribe to channel. Your subscription does matter to me if I want to continue on with my channel. Now it's Eid today, and definitely Malaysia is celebrating Eid. It's a Muslim festival, and I just say happy Eid to everybody.